Welcome to Imperfect Heart, a place for you to join me, Jeff Holden, in conversations, discussions, and dialogue about our hearts and the impact myocardial bridges have on them. We'll talk with healthcare professionals, those in related fields that support our condition, and others just like us with stories of their myocardial bridge experiences. It's my intention for this content to inform, educate, entertain, and even motivate or inspire you in your personal journey on dealing with a myocardial bridge. Most importantly is to have you leave each episode with hope, knowing you're not alone and that what you're experiencing is real. If you've been listening to many of our episodes, you know this program has always been about more than just the medical side of heart conditions. It's about the unexpected connections, the so-called coincidences, that remind us none of us are walking this path alone. Let's call them serendipitous interactions. Today's guest is a perfect example of that. Vesta Hurlbutt and I crossed paths through podcasting, only to discover a surprising common thread: the reality of living with and working around myocardial bridges. Vesta isn't just a podcast host, she's an X-ray tech in a cardiac cath lab, someone who sees the heart up close every single day. She's also on her own deeply personal journey, one she shares through her podcast, Open Heart Healing, where the focus is on opening the emotional heart, not the physical. She's a functional nutritionist, empowerment strategist, single mother, and she's helping those who have forgotten their power and want it back. Her podcast is all about rekindling self-worth, self-esteem, and cultivating self-love. But back to that cath lab experience. In this episode, Vesta and I talk about the power of advocacy in the medical system, what really happens inside a cath lab, and what you can expect when you arrive to the cath lab. It's a conversation that blends science and storytelling and provides hope that we are making progress. We now know there are doctors in the Hawaiian Islands that understand our condition. Vesta Hurlbutt, welcome to Imperfect
Hi,
Heart.
thank you for having me.
So, for frequent listeners of the program, they know that my journey has been, I guess I would say, blessed with what might be considered coincidence. The cardiac surgeon, the cardiologist that first saw me happened to come into the podcast studio 2 days with another client prior to my heart attack, which was crazy. And people go, wow, that's really amazing. Recently, I have one of my closest friends talking to me about some symptoms. He's not feeling well, and I've been telling him, you got to get it checked. He starts going down the path, and about 9 months worth of checking, I said, dude, you sound like one of us. You sound like you might have a bridge. He's like, oh, that can't be. I mean, these are supposed to be rare. I said, well, no, a lot of people have them. They're just not symptomatic. And he goes, okay. Well, he goes to the cardiac, to his cardiologist, and he says, look, I need the CT angiogram with contrast because that's supposedly the non-invasive standard that will tell us if I have this thing. Sure enough, he gets it. He's got a bridge.
hmm
He's my best friend. And he does an episode with us. It's Mark Davis, for those of you who haven't heard it. Mark Davis has a good friend who is also a friend of a neighbor of ours, and they start talking. They go, gosh, you guys all have these heart issues. Well, Janie just had surgery, and she had a bypass, and she went to Stanford for something. We don't know what it is. So I reach out to Janie. Hey, Janie, what's your deal? What happened here? Kind of just curious. Oh, I have this thing called a myocardial bridge. And I'm like, you've got to be kidding me. So this what people will call coincidence just keeps occurring and occurring and occurring. And now I can't wait to share the story of our meeting. Obviously, we do podcasts, and I love podcasting, and I'm going to this podcast convention in Dallas a couple weeks ago called Podcast Movement. It's the largest international podcasters convention. And we get the list of attendees, and I'm searching through the attendees looking for anybody that might have anything to do with, medical heart conditions or whatever. And I see this program called Open Heart Healing. And I'm thinking, awesome. Oh my gosh, there's actually somebody here that's got a program about, open heart surgery and the healing process. This will be fantastic. Well, I reach out to you and we're talking, and I realize this has nothing to do with open heart, literally open heart healing. Your program is more about mindset and life and oh boy, well, let me have you explain it. Tell us a little bit what open heart healing really
My
is.
podcast is about how it's my journey. I say how I opened my own heart. I was very shut down. I felt very stuck in my life. And I've always been, I feel like so many people are searching for, they're on that journey looking for like, I want more. And I thought everybody was doing that in their own brain. Like there's more for me out there, but I can't figure it out. But I was so closed down. And so my open heart healing is me learning that I'm responsible for opening my own heart and allowing love and kindness and all the good stuff in and out. When I let it in, it pours out of me. So that's what my podcast is about my journey. And I have guests on there who talk about it because I think it's really important, even for health. It's really important that you find that you can open your heart and you can talk to people. And I lost my dad not that long ago, and in his older years, he definitely opened his heart way more. I saw him cry more. You don't have to cry to have an open heart, but he just loved so much. He loved so much. And I think that's the journey for my open heart healing podcast. But the reason I call it that is because I work in a cath lab all day, every day. So I liked the play on words because I work physically with hearts all day, but it's the metaphorical me opening my heart.
And the beauty of all that is, here I am hearing the story about really this is a one person's life journey about being more transparent and authentic and learning how to relate differently. Come to find out, in my initial disappointment, darn,
I bet it
you know,
was. Yeah.
this is it's cute. Well, maybe there's something here. I don't know. And I do think there is for some of our listeners who are in that space who know that being more transparent, being able to open up will help them in their healing journey as well, literally,
Mhm.
as they go through the process of diagnosis and surgery and whatever the outcome is for their myocardial bridges. But as we continued the conversation, I said what I do, and you said myocardial bridge before I did. And I thought, "Well, wait a minute. Wait, what? What? How did you know this?" And then we go on to have this conversation back to the no coincidences about how you are an X-ray tech in a cath lab and that you see this all the time and that it's not that unusual to you. And I'm, smacking myself up against the head on how many people are gonna listen to this and go, "I can't find a doctor to accept the fact that I've got a bridge that could be symptomatic." So let's talk a little bit about that because I think what will help people understand from a perspective of somebody who's in that cath lab every single day doing things with hearts and working with doctors who are very, very specialized to the heart. What is it that you do? What does an X-ray tech in the cath lab
Yeah,
do?
so, when you get to me, that means there's a reason that you get to the cath lab. It could be a stress test, it could be a heart attack, it could just be chest pain, like, they're not just be, that is it's so I'm so conditioned could
That's good,
just
my
be chest
friend.
pain, but I'm so conditioned, but when you get to the cath lab, you come in and we take pictures of your vessels. There's nothing that will tell you more concrete evidence on whether or not you have blockages in your heart when you come to coming to the cath lab. It's the most concrete test. We take pictures, we look, we move the camera around, which is what I do, and I scrub in with the doctors. And if you need a stent, we put a stent in. Sometimes yeah. Uh-huh.
Which
Hmm.
we've had this conversation. Do it right
Okay.
here so everybody knows we are not advocating or thinking a stent might be an appropriate situation for a
Correct.
bridge.
Actually, every cardiologist I've ever worked with would not put a stent in a cardiac or a myocardial bridge.
We
And
love
that's
your
I've worked with a lot. I have been at I think 5 different hospitals. One of the hospitals I worked with 25 cardiologists. So I've worked with quite a few, and I that is not a standard of practice for physicians to put a stent in a myocardial bridge. But, like, if you have an actual
good.
blockage at that moment in time, we will put a stent in that blockage in any vessel of your heart.
Mhm. Okay, so back to the process. You actually are putting the stent on the wire,
Absolutely. Yeah.
yes?
So what happens is the doctor, because you don't want to go in and out. So we'll put a sheath in the arm or the leg or the groin, and then you go in with a catheter, and then the catheter sits there, and you put a little tiny wire in the heart, and then I load everything on the wire and help take the pictures and inject the contrast and whatever the doctor, whatever. Obviously, it varies by physician because some physicians are super independent and some physicians are a little more. They need they like a little more help from the tech.
In real time, are you speaking with them about
Oh,
things you
100% of
might
the time.
see?
All the time, yep.
You are? Okay.
And sometimes doctors a patient will come in and they might feel chest pain on the table and they'll say, "We don't see anything. Does anybody else see anything?" And even the, dare I say, grumpiest of physicians, even they're open to listen. I have never been with a doctor who won't be like, "Does," and I'll be like, "Do you see that? Is that it?" You work with some physicians and they don't rely on you, but they're just so comfortable with you, and they'll say, "Does anybody else see anything? Because does that look okay? Or what do you think about that LAD?" And all the physicians listen, and it's a team. It's a team. There's nurses, there's techs, and there's physicians, and we are a team.
So for the benefit of somebody who's doing this the first time, obviously there's a lot of anxiety. Walk us through what happens.
Mhm.
I'm the patient. I come into the hospital. I know that I'm going into the cath lab. Start as soon as I walk through the door. What happens all the way
So
to
you're gonna come
conclusion?
to, the hospital, you're gonna go to probably the admissions area. You'll get in a gown, you're gonna get IVs, you're going to get, depending on the physician, some physicians, depending on what you're coming in for, I'll say. I work with a physician right now, almost every single one of his patients gets preloaded with Plavix or something, but he has a different lineup of patients than everyone. A lot of times his aren't diagnostic, and we know that going in.
And Plavix would be the
Yeah,
blood
yeah.
thinner.
And
Okay.
that way, because he likes his patients preloaded. And so then you're going to come into the lab. You're wide awake, you're scared, and I always say this is the face you get to see in the cath lab. And I also always, I have a few things I say. One of the things I say is that, I'm sorry that this is the face you see when you're scared, but it is so normal to be scared. But we are going to take really good care of you. That's what I say every time, and I mean it from the bottom of my heart. We do everything to make sure you're comfortable. But I also have to say, like, you also have to be your own advocate sometimes, because sometimes patients just grin and bear it. And if you're in a lot of pain, then we need you to speak up. No, you don't have to yell or whatever. Just be like, ooh, ooh, and we're gonna be like, ooh, what's wrong? And that's what we do, because we want you to be as comfortable as you can. So then the physician will come in. We're setting you up, and when I say setting you up, this is probably the scariest part. If it was me, I think this is probably the scariest part, because there's four of us at minimum, and we're hooking things up. We're putting you on monitors. We're talking to you a little. We're talking to each other a lot. There's a lot of stuff happening. We always say we're like a pit crew. You come in and we come in. We all just get together, because you also have to think. Sometimes people come in and they have 100% blockage, and they're like literally dying on the
Mhm.
table. So we have to go really, really fast if we want to get that patient to live, right? So sorry. So when you come in, so we're kind of like a pit crew, and it's probably a little bit overwhelming. We're also covering you with drapes. You're wide awake for all this. So then the doctor will come in, he'll do a timeout, right patient, right time, right procedure type thing. And then we give you medicine and you get to go to sleep. And then most of the time, people don't remember anything, but there are other things. We get access. If you go in the wrist, we give this radial cocktail, we call it, and it's a vasodilator, so that makes the catheters go up and down the arm a little bit easier. And so, but it hurts, and people sometimes, it's so. I mean, and then we start the procedure. We go in different catheters for different vessels, and then we take pictures, and then assess, and then it all varies from that point on. Every patient is different and every patient is special. But you have to be your own advocate in every aspect of the medical field, because there's a lot of it is driven by, insurance. But I'm going to tell you, if we tell you you don't have blockages, that's the best thing you could ever hear.
Right. And I want to repeat something you said.
Mhm,
There's three things. Every
mhm,
patient is different. Every situation
absolutely.
is unique, and you have to advocate for yourself. And I cannot stress that enough because what you may read, what you may hear, what somebody may have said, that's all good information, but that's not you. And remember that you are unique to yourself, and there is no situation that's identical to what you're going to experience and or what your outcome is going to be. And yes, you always have to push and advocate for yourself, especially in a condition like this where it's seen more often than not as benign or asymptomatic. So for somebody with a bridge, you're saying, please look for this. This is what I'm concerned about. These are the things I'd like you to test. And something else that we had talked about a little bit earlier in our space right now, the gold standard is really what is called the provocative test, which includes an acetylcholine test, and then the Debutin challenge, which is a stress test, and then IVUS, which is the intravascular ultrasound. Your system, your hospital system there does the IVUS testing, you don't do the other 2, which is fine because we're still getting ourselves in a good spot by identifying it that way. Tell us a little bit about what that is, because people hear IVUS, IVUS, "Oh, what is this? There's a camera in my lung, my veins and arteries, and I don't know what's going on," and they get
Yeah,
scared.
it's just for me, it's so simple. It's actually more simple of anything we do. I just put the little IVUS. It's so small. I don't even know how big it is. It's so small. You put it on that wire I was talking about that we put down in the heart, and you just watch the IVUS, and you can see. And I honestly, we often do not IVUS a bridge because when you take a picture of the bridge or of the vessels of the heart, you can see the bridge almost every time. And if somebody said, "Oh, I think I have a bridge," they would IVUS. I'm sure. I don't know. I can't like speak for everyone, but I can't. Most of the physicians I work with are pretty, like, "Oh yeah, we'll do it," and just to see. But most of the time, you can see it. It's like it's pretty cool on a science nerdy based thing. Like you look at it and it like almost like blinks at you. It's like all the vessels are full and the bridge is like blinking. So it's a little.
Meaning it's
Yeah, yeah,
skinny,
but
it's a
like it
skinny
like
little part
in
that
and
keeps
out, and you
opening
can
and
see
closing and
it, and
opening and closing.
it's very cool. And I've seen it done on IVUS. And the other tests they probably do in the hospital, and just not in the cath lab. But
Right.
I mean, it's a pretty. As far as a bridge goes, we almost always see them pretty easily because it's usually on the LAD and it's usually pretty big. So, yeah.
Mhm. And that's something I'm really thrilled to hear, almost shocked because in so many cases, we'll have doctors say, "Oh, yeah, well, we may see it," but dismiss it immediately, or, "No, we don't see it," or see it and not say anything, which it's the most disturbing part because they see it as a benign condition, and so it's not your problem. Yet, in fact, "Oh, cool, yeah, we knew about it, but we just didn't say much," or we minimized the evaluation of the fact that you have it. And of course, we know for a fact that for some people, that bridge can create havoc in their life, all the way to including, sudden cardiac death through a heart attack because the bridge can cause blockage upstream. And then you have a problem. Or it could even cause ventricular tachycardia into flutter because the heart's trying to catch up with the lack of blood because the vessel's constricting. Maybe it's endothelial dysfunction for lack of better descriptions of other things. And then you have these ischemic issues. So
I
you get
do.
to see all
I
that.
do.
That is just incredible. In an overall estimate,
Oh,
put you on the spot here now. I don't mean to do that. Then you can say no if you don't. Just roughly, how many total have you done, let's say, in a year? Not anything with the bridge, but just,
oh,
cath
cath lab
lab
patients. When
patients.
I was at a place in West Virginia for 9 years. I just actually randomly, I because I was in Baltimore and then I went to West Virginia. Um, and I posted on, this is so odd, on Facebook how many cases we did because it was so overwhelming to go from not that many to so many. We did 40 caths my first day in West Virginia. So,
Oh my
however,
gosh.
that's because so West Virginia, there's a lot of Well, it's a very special state, and if you haven't been there, I'm so sorry for you because it's very underrated. I mean, I'm in Hawaii now, but it's still very underrated. It's beautiful anyway, but there's a lot of obesity, a lot of very, very unhealthy people. So we cath a lot of people, and a lot of
Mhm.
old like coal miners with the black lung and stuff like that. So we do cath a lot of people,
Oh,
yeah.
geez, yes.
And so yeah, however many that adds up to, I used to say we do anywhere from 30 to 50 caths a day.
My goodness, so you have seen a
Done a lot of
lot.
cases, yeah.
You have seen a lot. And then in Hawaii now,
Not that
roughly, what do you
many.
do on a daily
Well,
basis?
yesterday we did 5, the day before we did 4, and it varies, but I do, a different it's so I'm in a very small hospital now, and we do
And you're on
I'm
the
on
island of
Oahu. I'm
Oahu,
on
right?
probably I'm at probably the smallest hospital here. There's 2 here in Kuakini that are pretty small, and yeah. So we only have 2 labs, and we do other things too. We do IR, and when we used to have EP, we did EP too. So it's not just cath. So we have
Okay.
4. One just retired. 4 cardiologists that we work with.
If you were to guess just from your
Hmm.
Hawaiian experience in the time that you've been there, or maybe even just in the last year, roughly saying there's even if we just average it 3 a day, 15 a week throughout, is there a percentage you could say that you've seen a
Oh, a
bridge?
percentage? It's not that many. If I was in West Virginia, I would say I saw them weekly. 'Cause that was, that's,
Oh my goodness,
a lot
yeah,
more cats, but I would say, I mean, I would say this year I've seen at least 3, I mean, it's not,
okay,
and like I said, we don't do a whole lot of cases, so it's not like a
yeah.
super high volume place.
I'm laughing because I hear
Yeah.
some exotic bird
I would like to say
behind
sorry,
you.
but I'm not. It's a beautiful little area.
No, not at all. I love it. And what I'm really happy to hear is for the listeners that we've got in Hawaii, which there certainly are because, such a percentage of us has a myocardial bridge and some percentage is symptomatic, and that's gonna translate into Hawaii just as well as it does any other state, that there is recognition, and I'm sure that if it is in your system in Oahu, the same hospitals that are contracted with that system on the other islands are gonna have the same familiarity and the same awareness, and that if you do have the condition and you're going to the hospital systems in the Hawaiian Islands, the odds are pretty good that if you have a bridge, somebody's gonna at least they will at least listen to you to the point of understanding.
Yeah, I think, physicians are sometimes they're very difficult. Sometimes they're very stuck in their ways, as we all know,
Yeah,
And part of the reason I'm even here is because some of my struggles with Western medicine. I don't want to say my struggles, but I feel like we have a lot more responsibility in ourselves to take care of ourselves, but we also have to be our own advocates. Like that is the biggest thing I
mhm.
can say in all this. If you think something is not right, and you really feel that in your like deep down in your intuition, and and there's such a vast thing, like men have chest pain, women do not always, but most of the time. These are different symptoms, and that's for any kind of heart stuff. A lot of the research has been done on men thinking women are going to react the same way, and it's not the case. That's why I think it's so important that you advocate for yourself. And if you're not feeling well, if you're having chest pain and you go to urgent care and they're like, "Oh, you're fine." If you're not feeling well, you definitely need to advocate for yourself and be like, "Okay, well, I'm going to go and I'm going to take I just need to know." And that's okay. And some people might even, like, some physicians might even huff and puff, but they're going to do what they have to do. They always do. I have never met a physician in my life who disregards a patient completely.
Boy, you have worked for some wonderful physicians because if you could hear some of the stories of the people that communicate with me, some of the frustrations, the sheer dismissal, mostly women, and, "Yeah, honey, you're fine, it's stress, it's the kids, it's your husband, it's your job, it's your house." You name it, couple Valium, you're fine. And this occurs with almost every woman I speak with to where their challenges of getting recognized are far more difficult than it is for the guys. And yes, you have to advocate for yourself, and it's so frustrating on this end to know we're all the same. We're all humans. There isn't a difference in a proper diagnosis for somebody, and there isn't a difference in an understanding. There's a difference in treatment for sure, but if you have this, we need to recognize it, we need to accept it, and we need to help you in some way, shape, or form to the best of our capabilities to what will work. So I love hearing what you're saying, and I also do agree with you, and I think we're gonna do a couple of episodes in the next few months coming up where we're talking to nutritionists and an incredible doctor that is now known as the pain doctor, who was one of the staunchest advocates for the medical pharmaceutical side of things, who has now since retired and started a wellness institute that is 180 from where he was, and he will be the first to say I was wrong. He was treating all this stuff medically. We should have been looking at holistic things that we could have done, and not that there aren't some cases
Oh,
where, medicine is
100%.
appropriate, but
There's that's and I hate to put a damper on Western medicine. I work in there. It literally is my livelihood. But I think
Mhm,
like so often they're like, you just get a pill. But I became a health coach because I was like, I think people can heal themselves in way more instances than they cannot. But that does not mean
mm,
Western medicine isn't there for a good reason. Like they are there, and we just everybody, not everybody, so many people want a pill, and that like the quick fix and the easy fix, and even sometimes I'm okay with get the quick fix so you can find the core root of what is wrong and then work on healing
mhm,
yourself. Like a high blood pressure, most of the time that can be fixed without a pill.
mhm,
But if it's high, you're going to need a pill for a while because that can cause a stroke. And, you don't want, so
sure.
it's a balance. And that's why, learn, there's so much information you can learn about what you can do or whatever, how like your own causes. I think root cause of things is so important.
Yeah, and your own well-being with cholesterol, we know how to minimize that. You don't have to take the highest dosage of, atorvastatin to, or Lipitor or whatever your drug
Right.
happens to be. You can minimize some of that just by diet and weight and exercise and all the things that we know, not smoking. I mean, those are all those are the 3 questions right out of the chute that the cardiologist is gonna
Every
ask,
time,
right?
cardiologist,
You
then
know?
your nurse, then your, because I can't tell you how many times I've said, "Do you smoke?" I mean, like, because it's such a we and a lot of times we are the ones who ask the questions that need the answers.
Yeah, and that is the number 1 worst, and then obesity, and then, of course, high
Mhm.
cholesterol and
Yeah.
exercise. What do you do? Yeah, anything. You have been wonderful in the description. I feel a little bit of Hawaii as we're talking here, just, looking at you and looking out that window and hearing the birds. I hope everybody else feels some of that calm. But we didn't get into the specifics of open heart healing. Now that people have an understanding of you, they have a comfort level of where you're coming from. Tell us what somebody could expect if they listen to an episode, and then where do we
You
find
can
it?
find it on any place you listen to your podcast. My podcast is there. It's called the Open Heart Healing Podcast. And if I was going to suggest that you listen to any episode, it's episode number 2. My son interviews me, so it's the best episode. He's 22 today. Actually, today is his birthday. Yes,
Oh,
his
happy
name is
birthday. What's his
Blaze.
name?
Yeah, my sweet
Blaze,
baby
happy
boy.
birthday.
No, the origin story of my podcast is I was doing a mastermind because as much as I like this job, I don't want to do it forever. I'd like to be able to just travel. I don't like to feel stuck. And that is the epitome of me. 100%. It will be. So I smoked cigarettes for way too long before I knew better. It kind of sort of. I went to X-ray school when I was 28. Got a job in the cath lab when I was 30, and I've been doing it ever since. And I I quit smoking pretty much right away, almost, because I'm like, oh, that's the dumbest thing you could be doing, which I kind of knew, but anyway. But I felt stuck to the cigarettes. It's just this weird. I don't know if other people feel that way, but when I realized the stuckness was actually inside of me, And there's still I still have my moments, y'all. I'm just saying, but it's really inside of me. So then I just start doing this heavy, hardcore learning about myself. How can I be better? Not be better. How can I be happy more often? Right? I just want to be happy. I want to feel free. You ever go like swim in the ocean, swim in a pool, and you just feel light and completely just weightless. That's like the best feeling in the world to me.
Mhm.
And I feel that most of the time in my life, in the water, out of the water. So but I had to learn tricks and tools and figure out that who I am is exactly who I'm supposed to be. And and I have to be okay with that. And am I perfect? Absolutely. I'm perfectly imperfect.
Right,
It
right.
doesn't matter. Who I am is perfectly who I'm supposed to be. Do I make mistakes? Absolutely. Do I learn from them? I try my best, you know. And so that is what my podcast is. I do they're weekly now. I originally started it every
Good
other
for
week,
you.
and it says that in the bio, like it's going to be bi-weekly. I have so many guests. I've been doing it for a year and a half, and I love it. It's my livelihood. I do one solo episode every month. They tend to be everybody's favorite, but yeah, I love the interviews. It gives me a lot of things to think about, and I love to hear other people's stories, and just, everybody has something that you feel like sometimes, I don't know, maybe it's just me, but sometimes I feel like I'm not that special. I'm just me. But that's really your superpower, is I'm just me.
Mhm.
There's nobody else like me. And earlier when Jeff asked me about to say how to say my last name, and it's Hurlbutt, my name is Vesta Hurlbutt, and I was like, I'm the only one, but no
Yeah,
matter who you are, you're you, and that's your superpower. And if that's what my podcast is about.
and I think we will have some people check it out
Yeah,
because of the journey. This is a life-altering journey when you realize maybe you did think you were perfect. Well, you have an imperfect
that's
heart, I'm
and that's
sorry to say,
okay.
and and it's okay, it makes you
Yeah.
uniquely
And
you.
honestly, I'm on Instagram. That's where I do most of my stuff. I also have email. It's Vesta at vitalitywithvesta.com. If somebody's listening to this and you're about to have a heart cath and you need to be talked off the ledge of what you're expecting and you're so scared, just reach out to me. I don't care. I'll shoot you a message. I'll tell you what to expect, and to take a breath, and everything's going to be everything's going to be fine. And I will say, as staff members, we tend to talk a lot above you. If you feel unever, and not above you, but like almost like you're not in the room.
It's a
Yeah.
language,
And
yeah, you're like,
right.
who are you talking
And a
to?"
lot of times I'll say to my patients, I'll say, we're just having a conversation. If you want us to stop, just tell us. And that is, whatever we can do in the lab to make you feel more comfortable, everyone's going to do that. So just, we're all just humans, and sometimes we're just doing our job, and we don't want you to feel like we're just doing our job. We want you to feel welcome and comfortable and safe. So that's really important to the staff.
And I will put your handles in the show notes as well for people to know
Okay.
where to reach out. And I really appreciate that offer because I think you will get some takers who want to go step by step along the way, and the more information they can get, the more comfortable they'll feel, the more likely they are to move forward with the process to a better
Yeah.
quality of life. We've seen people scare themselves out of
Right, and
living
that's
well.
the last of it. That if you're afraid and you're not living your best life, then you need this podcast and my podcast.
I appreciate that. Well, Vesta, thank you so much for taking the time to demonstrate the value of transparency through your podcast, if nothing else. The value of connection in spite of what might have been an easily dismissed situation. I mean, I could have walked away once I learned your show was nowhere near my space, yet
I almost didn't respond. Because it's not near
well,
my space. And then I was like, "You know
right.
what? If nothing else, I can just have a conversation," So I was kind of like, so that's how, because I was like, do I respond? Because because we are far apart as far as podcasts go. So I thought the same thing, and I was
Yeah.
like, can't hurt. I'm here for networking. I'm here to meet people, and I know a little bit, obviously, but I was like, can't hurt.
Yeah. And we both could have, but didn't. And again, there's reasons for that. That it's fortuitous, it's universal. I really don't believe in the coincidence thing. I think it's all meant to be. When
I
it happens
agree.
for a reason. So here we are having a conversation. I know we will help people both ways, multiple ways, may help people even without the bridge, the spouse of or
Mhm.
significant other of who's dealing with it, or somebody who just happens to be in the same space that you were when you started your podcast, looking for something better, knowing that, oh gosh, I have this issue, this physical issue, but I also have this,
Mhm.
mental, emotional mindset issue as well that yeah, maybe there's something there that could help me accept this other journey
Yeah,
a little bit
yeah.
easier.
And there's different health methods to, with eating healthy and trying to eat a more heart healthy diet. That's we talk about that on the podcast sometimes too. So, there are a lot of things that,
And I did notice you have a fair number of doctors, which I'm sure are coming from your
yeah,
circle
I
of
hope so.
influence.
Yeah.
Yeah,
Yeah.
yeah, which is great. Well, Vesta, thank you so much. I appreciate what you've done from the bottom of my imperfect heart. I sincerely appreciate what you shared
Thank
with
you
us
so much
today.
for having me. It's been really fun.
Thank you for listening to Imperfect Heart. It's my hope that this information helped in some way to improve your situation or will help you better understand this condition. More importantly, that it gives you hope through stories that there is help and you most certainly are not alone. If you've been diagnosed with a myocardial bridge, please be sure to join the private Facebook group, Myocardial Bridge Support Group. For more information about our program or to reach me directly, visit the website, myimperfectheart.com. If you like what you heard today, please give a positive review, thumbs up, high five, or whatever your app likes. And be sure to share with everyone important to you so they understand what it is you're dealing with. Please subscribe as well. Welcome each day with gratitude and positivity. The views and opinions expressed in this program are solely those of the host and the guest and are not intended to provide, nor are they a suitable substitute for, professional care by a doctor, therapist, mental health professional, or other qualified medical professional. Imperfect Heart is a production of Hear Me Now Studio.